days. Police will prepare reports for the coroners on these cases. We do not want to see any more lives lost, so we implore the community to please take care in your car and never drive through flooded roads. Motorists are advised to avoid the Yarra Ranges and the Dandenong Ranges with multiple trees down across roads and power outages. As a result of flood and storm damage this week, we are asking Victorians to please avoid visiting national or state parks and forests until declared safe. So please, everyone, follow the advice of VicPol and the SES and other first responders to stay safe in these communities. So now on to the COVID updates. There is one new locally acquired case of coronavirus in today's numbers, bringing to the total number of active cases in both the community and in hotel quarantine to 74. It was the Chief Health Officer yesterday who said 1 day of 0 cases doesn't mean the job's done, and that there would be other cases and that we still need to remain vigilant and ready to respond. The new case today lives in the City of Melbourne, and our team will continue their investigations today as to the acquisition source of that case, which came in very late last night. The team spoke to the case last night and is conducting further interviews today. This case has done all the right things. From our initial interviews, the individual recognised that they had symptoms, got tested, and had a test result all within the same day, that is, yesterday. Our public health teams are also continuing their other investigations into the cases in Reservoir and have completed lengthy interviews with the Victorian couple who have tested positive in Queensland. I want to take this opportunity to thank the 15,110 people who braved some pretty rough weather yesterday to get tested. We are now clearly in the throes of winter, and you might just think that the slightest sniffle or sore throat is just something that happens in Melbourne and Victoria in winter, that it's nothing to worry about, it's just part of our winter life. But as we have learnt over the course of this past 18 months of pandemic, we need to respond to the symptoms of coronavirus, however mild, as soon as we detect them. So please, do the right thing, get tested quickly, and give our public health team the chance and the information they need to stay ahead of the spread of this virus. Lilydale, Yarra Junction and Emerald testing stations are closed today due to those power outages that we referred to earlier. They are expected to reopen tomorrow, but the communities in the eastern suburbs still have access to nearby testing stations in Boronia, at the Wanturna Trash and Treasure site, and at Ferntree Gully. These alternatives close by continue to operate. When it comes to vaccination numbers, they continue to be strong in Victoria. Yesterday we had another day of over 20,000 vaccinations. This was another day in our state clinics, that is. This is another day of Victorians visiting vaccination centres, and of course, with the majority of vaccines still going to our partners in GPs and our local medical clinics, this partnership between the state and the GPs is delivering strong results for vaccinations. We've seen that every day over the last 3 weeks, really good numbers of Victorians have stepped forward to receive their first dose of the Pfizer vaccine. Under the Australian Technical Advisory Group on Immunisation, ATAGI's guidelines, people who get their first dose of Pfizer need to return within 3 to 6 weeks following that first dose for their second dose, and thus get the full benefits of the vaccine's protection. Some 50,000 people are already booked in for their first Pfizer dose in the coming week, and that is fantastic to see. That's bumping along at the maximum of new first doses we can do, whilst we also deliver the second doses for the tens of thousands of other as they start to fall due. Of course, every first dose booking in the system for the next weeks will proceed. Into the future, tens of thousands of Victorians will continue to be able to book an appointment for their first dose of Pfizer, and new appointments will be made progressively available to people as their second dose schedule falls due. And when more doses are delivered by the Commonwealth, we'll be able to increase the number of bookings for first doses as well. I stress that booking ahead is important given those high levels of demand. Since the commencement of the vaccine rollout in February, Victoria's state clinics have delivered over 772,000 doses. Of those, over 350,000 first doses of Pfizer, over 91,000 second doses of Pfizer, over 320,000 doses of AstraZeneca, and almost 10,000 second doses of AstraZeneca. That's almost 190,000 doses administered by our state-based clinics. That puts us ahead of the next comparable state jurisdiction. So clearly, as more doses become available, we will continue to increase the number of appointments made available for Victorians to book their first dose vaccination. More broadly, when it comes to restrictions, yesterday was a good day with kids back at school, restaurants, cafes and pubs open again with their well-deserved meal and drinks with friends and patrons. And we know that restaurants, cafes, pubs and retail stores are back open again, but clearly with density limits in place, and that's all about making sure that we carefully and gradually reopen safely based on the public health advice. All categories of elective surgery will recommence in metropolitan Melbourne as of Tuesday. This is all about staying COVID safe, and staying COVID safe is the way in which we will continue to carefully and cautiously reopen. As we start this long weekend in metropolitan Melbourne, you still cannot have visitors to your home unless, of course, that is your intimate partner or a single social bubble. You can see friends and families outdoors in public spaces, but in no more than a group of 10. Restrictions regarding travel for no more than 25 kilometres from your home, or travel into regional Victoria from metropolitan Melbourne, except for work, for study, for care, or to visit a vaccination centre, continue in place. Importantly, of course, you can leave home in case of an emergency. But please, wear a face mask. It's easy to do and dramatically reduces the risk of the virus spreading. These need to be worn indoors and outdoors unless inside your own home, or in the case of exceptions that apply under the state public health orders. Different restrictions continue to apply in regional Victoria, where you can have up to 2 adults visit your home per day and wear face masks whilst mandatory indoors. They apply outdoors where you cannot maintain a 1.5 metre distance from others. Outdoor gatherings in public spaces in regional Victoria are limited to groups of 20. So my message is that if we all stick to these directions, we increase our chances every day of continuing to drive this current outbreak down and to return as quickly as possible to the kind of life that we want to aspire to, where we were for 86 continuous days of no community transmission. So my message is, please keep applying the public health rules and be doing what we Victorians have been doing for the past few weeks. Use the QR code system wherever you can and wherever you're obliged to do so. Please get vaccinated when the opportunity arises, and please, most importantly of all, get tested at any of the continually operating vaccination centres right across our state. It's the most important thing we can do to stay ahead of this virus, to give our public health team the information, the intelligence they need to drive this virus down to where we want it to be, at no community transmission. I might ask Jerome to add to my comments, and then we're happy to take questions.
Thank you, Minister, and good afternoon. There are 74 active cases of coronavirus in Victoria at the moment. 3 people still in hospital, but they are doing well. I wanted to take a moment just to talk about the 2 outbreaks we're really dealing with. One, the larger Kappa outbreak that we've seen really develop over the last 2.5 weeks from the city of Whittlesea, Port Melbourne, through the Our Care aged care facility in Maidstone, through Reservoir, and most recently, of course, to our 2 Victorians in Queensland. These are all branches of the same fundamental outbreak. Originally, of course, transitioned through a Victorian coming out of South Australia quarantine system back into Victoria, and we've seen it develop over the last few weeks. Collectively, over that outbreak, over those different branches, we still have 2,300 primary close contacts who are isolating, but over 4,000 primary close contacts have now been cleared. And my thanks again to the over 4,000 people who've completed their isolation in support of running these branches, this outbreak to ground. And my thanks, of course, to the 2,300 who are still doing their remaining days in isolation. And I know, and I can appreciate that as we ease restrictions across the rest of Melbourne and Victoria, it's even more frustrating to be caught up in isolation. But it is so very, very important that we finish this off. We've seen in this outbreak a number of people turn positive on day 13, so we really have to make sure we finish those isolation periods with negative tests and that you're released by our public health team, who continue to work around the clock to ensure that we support everybody who is in isolation and quarantine and detecting any other cases we may have out there. But with this Kappa outbreak across all those different branches, we can start to see all those connections. Genomically, they're all connected, and we have strong, obviously some very strong linkages and some other more tenuous linkages that we're continuing to explore. But what's important is that the case that the Minister just referred to, a new case emerging late last night, again, we have strong reasons to believe they'll be connected into this wider Kappa outbreak. The case of the elderly gentleman in Reservoir from a few days ago who came forward and got tested very shortly after symptom onset, and of course the staff member at Our Care about 10 days ago who again immediately on symptom onset got tested. What those 3 individuals as examples have done is got tested immediately when they had symptoms, and in doing so they've allowed us to discover new branches of this wider outbreak. Our concern at the moment is that there may well be more people out there. There may well be more branches out there from this outbreak. Although we're convinced we have the trunk, we understand where it's come from, we understand the majority of the branches that we can see at the moment, that there may still be more branches, small outruns out there. And we've shown collectively over the last 2 or 3 weeks across Victoria how effectively we can when we work together to run those individual outbreaks to ground. But it's so important now, whilst we still have some restrictions in place, that we identify any other branches that may be there. So if you're somebody who is worrying about whether you've got symptoms, we really want you to come forward and get tested today. Please do what our case did yesterday. He was symptomatic yesterday morning, he got tested yesterday morning, he had his result yesterday afternoon, evening, and we were able to work with him and talk to him last night. That kind of swift action allows us to roll these things up really quickly. And it's so important that we identify any other branches of this Kappa outbreak that may be out there. In terms of the West Melbourne outbreak, the Delta outbreak, we now have 761 primary close contacts, primarily associated with the school children who have now been released from their isolation. Again, my thanks to those, to the kids and to the families for their hard yards over the last couple of weeks in doing the isolation. There are still 764 primary close contacts that are still in isolation. We'll be working with them over the next few days to get to the end of that cluster. I'm pleased to confirm that, again, my thanks to North Melbourne Primary School. They will be reopening, I understand, on Tuesday. They've now been completely deep cleaned. They've been cleared, and it's great to see so many of the kids coming out of their isolation period. And we wish them all a really effective return to school. I know they'll be very keen to do so on Tuesday. You'll have noticed last night that we identified a few additional exposure sites, primarily associated with our reservoir case, particularly exposure sites in Bundoora, in Epping, in Reservoir itself, and in Thomastown. Again, I'd please urge anybody, particularly in those suburbs, please check our exposure list site. If you have any exposure to those locations, please come and get tested immediately. As the Minister has said, we have over 207 testing sites up and running right now. Demand on the system is pretty quiet. If you go now today, you'll be seen very quickly. You'll have your results within 24 hours, as indeed more than 95% of people do. In terms of our Queensland, Victorians who moved to Queensland, there are a number of Tier 2 sites we've identified that now go back a number of weeks, right back to the 18th of May. So this looks increasingly like an older set of cases who have come to the end of their infectious period. There are a number of those Tier 2 exposure sites. Again, I'd ask people to check those exposure sites, and it goes back to the conversation from earlier. We believe there are other branches that may be out there that we have not yet discovered. It is so important that anybody who's remotely symptomatic comes forward and gets tested. Because if you get tested and if you have symptoms, if you've been to an exposure site, that's what we need you to go and do. You need to protect yourself, because we've seen all around us how serious COVID can be for some members of our community. Get tested to protect your loved ones and those people that you live with, because we know that coronavirus spreads so easily inside the home. Get tested to protect your community, because if you have coronavirus, you're exposing everybody else. Every time you go out to shop, every time you go to work, every time you get a coffee, you're exposing others to the risk if you have COVID. And ultimately get tested to protect our entire state, our healthcare systems, and our frontline workers. We know that there is still a risk that this is happening, and I'd ask you particularly as we increasingly start to go back to work again, as our retail stores open up, as hospo opens up, as people start to go back to the workplace. Don't just think about yourself, think about the people next to you. If you've got a colleague who's got sniffles or is complaining of a sore throat, make sure they get tested and that they're isolating and staying at home. If you're being treated by somebody who looks like they've got the sniffles, you should ask them, have you been tested? Because we need to make sure we run this to ground now. We do not want to be here again dealing with lingering cases of COVID in our community as we start to open up. Finally, on vaccinations, just to back in what the Minister said, so we have a busy program ahead of us now. It's fantastic to see that over the next 3 weeks in particular, all those 300,000 or so Pfizer vaccinations we've done in the last 3 or 4 weeks, over the coming 3 or 4 weeks will be coming up for their second doses. It will be great to get them to the end of their vaccination journey, and we'll absolutely prioritise all second doses to come forward and get done in time. If you've had your first dose of Pfizer, please make sure you've got your second dose booked in. If you haven't booked it in yet, then please do so over the next few days so we can get you in on the schedule that you want to be on. There are, of course, as the Minister has said, already a number of first doses booked in over the coming weeks. Of course, we'll run through those. We will be constraining walk-up, as we've always said. Pfizer is about booking ahead. If you're a second dose person and for whatever reason you haven't had your booking, please go to our website and you'll see a small number of places where you can walk up for your Pfizer. We will not be doing Pfizer walk-ups for first doses over the next few weeks to make sure that our second doses can come through clearly. Again, we will be running, at least as we are now running the largest scale vaccination program anywhere in Australia. We will continue to run Australia's largest vaccination program at least over the next 3 weeks. We will go as fast as the doses that we have allow us to. We thank everybody for their support in coming forward to get vaccinated. With that, the Minister and I will take any questions. Nick.
Are you confident that it's going to be connected to the Kappa? Sorry, are you confident that it's connected to our initial outbreak?
Yes.
This individual.
Yeah, I mean, yes, it's obviously. Sorry, I cut across you, but yeah, look, it's early days. But based on the information we received from the individual last night, we are awaiting genomics over the next few days. There are a couple of leads already that indicate to us some very clear crossovers to other parts of the Kappa outbreak. So we're at this point in time, that's our lead line of inquiry.
And just in terms of the exposure sites, so the latest exposure sites you've added, is that related to that case? And can you at least tell us if it's a man or a woman?
No, so the case is a man. So it's a man from the city of Melbourne. So he's a younger individual with a family at home. So far, he's had relatively limited excursions outside. He has a very young family, so it's been mainly caring responsibilities that he's had to deal with. So we will be working with him now to identify any other exposure sites that might be there. Most of the ones that went up last night are around either the reservoir information and the Queensland information. So they're the ones that we're drawing attention to at the moment. Nick.
So to clarify, are there any exposure sites at the moment for the new one in Melbourne?
I don't think so, Nick. Certainly there's more information. We're talking to him this morning. So we spoke to him late last night to get an initial sense of movements. We'll be talking to him again this morning to confirm any any exposure sites now go up today.
Can you also explain why you think there is a connection? In vague terms, what is the connection?
So there are some, both in terms of the proximity of residents. So there are some very close adjacencies in terms of where he lives and where some other cases live, and there are some early indications of some overlap in social places. So more work to be done, and let's be very clear. He's not a primary close contact, so he is a new case, and at this time it's a mystery case. But the lead line of our investigation is that it will be connected to the wider Kappa outbreak, and it kind of talks to this whole the conversation we've had over the last few weeks. We're seeing a number of different branches emerging from this Kappa outbreak, and that's what we're very keen to run to ground.
Why is it that you feel like there are other branches out there? You mentioned it a few times.
Yeah, look, if you look at the last 3 days, I mean, we stood here on Thursday, we talked about the reservoir case, again, confirmed Kappa strain, again, a number of adjacencies in terms of exposure to a number of public exposure sites from previous cases. We looked at the Queensland case that came up 3 days ago, again, a lot of overlaps to again, some of our public exposure sites, again, a confirmed Kappa strain. And here we are again with, on the one hand, a standalone case. Early indications, and I stress early indications, are that again we're seeing some overlaps with other parts of the existing outbreak. At one level, that's reassuring. Obviously, being able to connect these cases up and be very clear what we're dealing with. We're dealing with one great big root ball here with lots of different branches. That's helpful, but we do need to ensure we've got all those branches identified. And what I'm a little bit concerned about is that being well advanced now, we're almost 2.5, almost 3 weeks into this outbreak, that we're still finding new branches is a little bit of concern. And it goes to our testing numbers that are starting to drop day after day after day. My urge to all Victorians and to all Melburnians is, I suspect there are still people out there who've got symptoms, and there are still people out there who may be harbouring COVID. We need you to come forward and get tested. And that is the single most important thing you can do at this point in time. Nick.
In terms of that Delta cluster,
yeah.
How confident are you that we're fully on top of that, the one linked to the West?
Look, I think the Delta cluster, I mean, the last time it's been a number of days now since we identified a new positive case associated with the Delta cluster. It's been really well contained right from the word go. So we identified that initial family of 4, we got the other family of 4, the school, and all those linkages were made in the first few days. So it's been at least 5-6 days now since we've identified a new Delta case. So that's somewhat encouraging. A lot of genomics work has gone on, a lot of epidemiological work's gone on to connect, to try and connect that family back into the entrant, as it were, the Victorian who came into Victoria on the 8th of May through our quarantine system. We haven't established a definitive link, a number of leads still to explore. But we feel that as every day goes by, as we're seeing stability in the primary close contacts, as we're not seeing any new cases come forward, it makes us feel more confident. But again, you don't know what you don't know. And the only way that we can really build confidence is by sustaining really good testing levels across our communities. We know that this time of year, a lot of us are going to start getting colds and sore throats and sniffles. We want all those people to be reflected in our testing numbers to make sure we've got everybody out there who might be harbouring COVID in the community.
Is the reservoir case still considered a mystery case? Are we still in?
No, sorry. It's certainly a Kappa strain case, and again, we've got a number of links to public exposure sites from the other cases. So look, it is certainly part of that Kappa cluster, that Kappa group that we're dealing with. We haven't got a definitive index case connection into the rest of the cluster, but all the other evidence points to it being connected.
What would you say to people who think, well, I haven't been to an exposure site, I should be right?
I would say get tested. I mean, the very fact that none of these people, the gentleman yesterday, I suspect would have said, I haven't had this conversation with him, but I suspect he would have said, well, look, I'm not living in an exposure site. I don't work at our care. I don't shop at Craigieburn Centre. Therefore, I'm probably okay. And he went and got tested. That is what we all have to do. We cannot assume that we know what these connections are. And every single day, pretty much in the last 2 weeks, we've been identifying new exposure sites as new information has come to light. So,
how are you feeling personally? I asked Professor Sutton this yesterday. How are you feeling? Are you feeling anxious about this opening up?
No. I'm feeling really confident that we've got an exceptionally good grip of the outbreaks that we can see, of the positive cases that are out there, of the primary close contacts. all the momentum and the speed at which we're collectively operating, I'm very confident about. Until about 3 days ago, I was really confident about testing numbers. I think I'm a little bit concerned that testing numbers are starting to drop. And I think whilst we're still dealing with new cases emerging, I would really encourage people to help us keep those testing numbers up. That'll give us the best feel that we're getting a good cross-section of people coming forward. And look, I'm always concerned when you see new cases coming up. The conversation we were having 5-6 days ago was around primary close contacts turning positive, day 13 tests coming back positive. That's well within our control, but there are no dramas around that. But whilst we see new cases coming up, there'll always be an area for concern.
Jerome, how widespread do you think this issue is? How many undetected cases? Are we talking several, or could there be dozens?
This is the thing, we don't know. So I think if you look at if you look at where we were for the first 2 weeks of the outbreak, when we were doing 30, 40, 50,000 tests a day, we were getting a really comprehensive trawl of people out there. That gave us a lot of confidence that we really started to see the outbreak shaping up and where those branches were going to. I think that the last 3 or 4 days with those lower testing numbers and you're picking up the 1s and 2s here and there is a little bit concerning. So my personal view is, for what it's worth, and Brett's view is more important in that regard, my personal view is that there are certainly more cases out there. I think we're talking very small numbers, but we really need to track them down, because as we've seen, if we let them linger and if we let them build, and we've seen how infectious this Kappa variant can be in certain settings, we really want to get it under control.
So how do we do that? You can encourage people, obviously, to come forward to get tested, but it's up to each of their own. So
look, it is, but I think also, and again, what we saw back in late January and February of this year, when the schools first started going back, we saw this phenomenal attention that schools were paying at that time for kids coming to school with sniffles and bugs and various other bits and pieces, and we saw a real upsurge in our testing numbers for the first 3 weeks of February. That's exactly what I want to see this time round. As businesses start opening up again, now we've allowed people to start going back into work in small numbers. As retail's opening up, fantastic. If your colleagues, if your employees are coming to work symptomatically, get them tested, send them home to get tested immediately. If you're being served by people who are symptomatic, call them out in the nicest possible way. If you've got people at home who are walking around sniffling and saying, no, I've just got a cold, ask them, have they had a test? That's I think the collective response we need to see. If we see that real step up over the next week to 10 days, where we can really see these numbers coming through again, and then we start to see no positive cases coming up, that's a good thing.
When you come in on that point, Jerome, what would you say to people? Because it can be an uncomfortable conversation, but should you ask people if they're being tested, call them out as such? Absolutely.
Look, and I think all of us will, increasingly large numbers of us are going back into work. Large numbers of us are going back into shops. We're going back into cafes and restaurants. We're going to be mixing with more people again. That's a wonderful thing. We all want to be back in that world where we were, before the end of May. But I think part of that is then, a responsibility on each of us individually, not only to get tested ourselves if we think we've got symptoms, but also to ask people that we're dealing with and saying, Sarah, are you okay? And is there something else if you're not feeling well, have you had a test yet? Because that's the one thing we need you to go and do.
We asked the Minister.
Of course.
Sorry.
Have the family members of today's case been tested and they got results?
So the family members were being tested early this morning. We should have results of them later on today.
How many people are in that family?
There are 4 people in total in the family.
And you just said early indications suggested there may be a crossover in some social settings. Are you able to expand on that?
No, not at this point. So early conversations. So we started our conversations with the new positive case late last night. As I've said, he's been exceptionally cooperative and being really, I think a model in terms of coming forward so quickly. Having symptoms yesterday morning, getting tested yesterday, and getting your results all the same day, and being contact traced that night. That is just a phenomenal performance, and what we all need to be doing. And I can assure everybody, if you're getting out and getting tested today or tomorrow or on Monday, you will have your results 95% of the time within the 24-hour period. We will, of course, continue our conversations with the positive case and their family this morning. As exposure sites start to emerge, we'll put them out there.
Is there an ideal daily testing number that you want to see from now on?
There's no one number. I mean, I think certainly as you start to get, when you're dealing with active outbreaks and you're finding positive new cases, as we are in the last 3 or 4 days, I'd want to be north of 20,000 a day, really as a rolling average. But the higher that number goes, the more confident we are that we've got a good sample of what's happening across the city.
before we Rico, sorry, can I ask
Oh,
you one
okay.
more? Just given that we've had these new outbreaks, it's kind of changed the landscape a bit. So there was discussion about restrictions further easing on Thursday. Is that still in place, or is it too early to?
Look, I think as Brett has said a number of times, it's all day to day. Look, we review where we are. We review the settings every day. We'll be doing that every single day over the weekend as to what trajectory that we're on. It's far too early now for us to be talking about Thursday. All the information we get will be helpful. But again, I say, if we're in a world where we're seeing really low testing numbers over the next 3 or 4 days, and we're still finding 1 or 2 cases in that, then that makes the decision on Wednesday, Thursday so much harder to make. If we're going into a trajectory with high, strong testing numbers and only positive cases that are already known about, then that puts you clearly in a much more positive position.
Minister, a lot of the tourism areas around regional Victoria are reporting today it's very, very quiet and they're really suffering. What would you say to them, and is there any hope on the horizon for them?
Look, there's always hope on the horizon when we drive this outbreak down to zero community transmissions. All Victorians have great sympathy, particularly for small business, particularly for tourism businesses who are doing it really tough. And that's why the Treasurer and the Minister for Tourism, Events and other arrangements have put in place, I think it's over $500 million worth of support. We've had some support from the Commonwealth, that's for employees, but we'll continue to work with those sectors to make sure that they get through this as quickly as we possibly can. And we look forward to all Victorians getting back out and about and supporting those important regional tourism operators and indeed all of our businesses.
But to that, Minister, we've got school holidays coming up soon. That will obviously be a good chance for these tourism businesses to get a lot of business coming through. Does that play any role in your thinking around rules like the 25-kilometre restriction?
Of course, the public health team take into account all of these multiple different influences, but the key driver is what's the public health data telling us. The very issues that Jerome just went through. What cases do we have? Are they linked? Do they reflect mystery cases? Are they on the back of high levels of testing? All of these factors, the public health factors, drive the core of our response. But of course, we take into account wider issues of the community's well-being and other issues. But what we have to do is to completely reopen and sustain being reopening on the back of high vaccination rates and on the back of appropriate management of quarantine systems as we move to a greater risk-based focus of how we manage our international borders. Put all of that together, these are the things that will get us open and keep us open.
Just on another matter, there are reports that the Yulorn power station, or the mine there, sorry, has been evacuated. Do you have any information on that at this stage?
I understand the relevant authorities have made some public comments about making sure that safety is the first priority and making sure also that the power arrangements across the grid continue to meet demand. So I have to refer you to those comments, which I think have been made earlier today.
In terms of Victorians going to Sydney for the Queen's birthday match in particular, are there restrictions on Victorians leaving the state at the moment?
Yes, there are the general restrictions that apply to all Victorians. There's a number of limited exemptions provided that have been granted by both New South Wales and Victorian authorities for the general reasons that you can seek exemptions. But as a general proposition, travel from Victoria into other jurisdictions isn't permitted. With the exception of the bubbles along the border with Victoria and New South Wales and other arrangements that are in place.
But just to go to a football match, it would not be.
I don't believe so, Nick. Obviously the players and the clubs have exemptions from New South Wales Health and arrangements that have been in place with the AFL.
And in terms of the AFL, have you been meeting with the AFL obviously they have to plan next weekend. It's a rolling situation. Have you already discussed with them and said next weekend's going to be too optimistic to play footy in Melbourne?
Not me personally, but I know that the government is in frequent conversation, both through DJPR and the Department of Health with the AFL on what the prospects look like. And at the moment, as Jerome's indicated, it's too early to tell. What we need is the certainty of high levels of testing and driving down on the back of that cases that aren't linked, and that if we do have cases, the certainty that they are corralled and under careful management.
And can I just ask you one question also about community sport? I understand you've announced some grants.
Yes. So the Minister for Community Sport has announced a range of supports, particularly $2,000 cash grants to clubs, community clubs that are the heart and soul of so many of our communities right across the state, to keep them going in the replacement of losses over the canteen, events that have been foregone. And we hope that that will help sustain those clubs. And when we come back stronger.
There's been some more questioning today from experts on the merit of wearing masks outside. Do you think your government could refine its messaging on public health and focus more on the big interventions that you know make a difference rather than relatively lower risk situations?
Well, I'd dispute that wearing masks is a lower, what did you call it, value intervention. I think Professor Sutton addressed this yesterday. It's a low cost but high value intervention. And I think Professor Sutton addressed the issue in terms of its proportionate value being somewhere between 15 and 20 times impactful both indoors and outdoors. And I've seen some of the reports in today's media, but I've also seen in today's media international reports that point to the high value and perhaps the enduring nature of mask wearing right across the globe in infection prevention and control. So we certainly support the arrangements are in place around face mask wearing. Everyone good? One more?
But we're told call centre operators have been ordered not to take Pfizer bookings until late next week. Why is that?
That probably goes to that issue. I'm not aware of the specifics of what you're addressing in your question, but I think I did address the management of first and second doses of Pfizer and making sure that those people who are already booked in for both their Pfizer first and second doses, as we now clock over into those second doses, that all of that's delivered within the constraints of the supply that we're provided by the Commonwealth. And I want to thank the Commonwealth for the extra provisions that they've announced a week or so ago. That's now flowing through our system. But what we clearly need to calibrate is the first and second doses so as to make sure that we follow the national guidelines on the 3 to 6 weeks gap between first and second for Pfizer, and I think it's 12 to 15 for AstraZeneca. Managing those as we flow through the system is an important part of the sustaining the growth in the vaccination program.
Can you walk up for your second Pfizer dose, or do they still? I know the first has to be booked, but can you walk up for the second?
For all Pfizer doses, our very strong recommendation is please book. You need to book, and particularly as we now essentially start to, in effect, double the number of Pfizer demands as we roll first and second doses out, booking is essential.
You speaking to the federal government about getting more Pfizer?
We speak to the federal government at an official and ministerial level frequently, and the federal government have now pretty solid pipelines of predictable both AstraZeneca and Pfizer supplies foreshadowed, certainly for the next month, and we look forward to those commitments being delivered, and we're making no suggestion that they won't be. The evidence is that the Commonwealth are sticking to the schedule.
So are we effectively running out because of our demand at the moment?
Well, Victoria is delivering, I think the figures show, about 40% of the nation's vaccines at the moment. After the most recent National Cabinet, the Prime Minister was very clear that he didn't want the states to stockpile, that he wanted the states, and all the states are doing this, getting those jabs into people's arms as quickly as possible, and that they would manage the supply to all of the states for the second doses. And I'm confident, because the evidence supports this, that that's exactly what the Commonwealth are doing.
So can we now guarantee that people who've had the first Pfizer will definitely get the second Pfizer at an appropriate time?
Oh, absolutely. So we operate within the ATAGI guidelines. Clearly, what we get sets the parameters for what we can get out the door. I think the most recent figures released by the Commonwealth show that Victoria's got the equal highest efficiency level of getting vaccines once they hit the state back out to the vaccine state clinics, running at over 93%, the highest, equal highest in the country, and we'll continue to do that. But of course, we can only get out the door what we get in the door, and what we want to do is to make sure that that balance between first and second is maintained within that demand.
Okay, I've just got one on density limits on hospitality that you've imposed. Look, just going back to that outbreak a while ago in that South Yarra nightclub where we saw that infected person and no community transmission. Can you firstly explain that and then explain then why there are these caps?
Well, within the limits of a non-clinician and a non-infectious specialist, infectious diseases specialist, my layperson's interpretation of having sat through many briefings on that issue is that the young person doing all the normal things that young people will do in their lives, perfectly legitimately and perfectly entitled to, given that there were no real restrictions in place, turned out to be one of those people who doesn't transmit. And all of the great work that our contact tracers did with all of those venues, partnering with their social media platforms, their QR code systems, their data from commercial transactions across the bar, we got a very high level of testing and penetration through those primary close contacts. And in those particular venues, there were no transmission. So it goes to that issue that we've talked about quite a few times. Most people don't transmit or transmit very low levels of virus. Some people, for reasons that I'm told we're still yet to grapple with as to why, some people spread a lot. And in this particular instance, it was the former, not the latter.
So can you give any assurance to the arts, the events, the entertainment industry that are kind of the forgotten child sometimes on these roadmaps? They're always last to reopen. Cinemas, large-scale events. When can they start to see life come back to normal?
Look, we know that this is having a big impact on so many parts of our cultural sector, our small businesses, our tourism operators. When we drive this down to the position where the public health team are confident that we can return to those circumstances of 86 continuous days of essentially being open, but in a safe way, in a way in which the new rules of distancing, QR coding, personal hygiene, and making sure that if you show the slightest signs of illness that you get tested in the depths of a Melbourne winter, that's the package that will get us back to being reopened as soon as we possibly can.
Just on vaccines, are you concerned that eligible people, say over 50, are holding off from getting their jab due to a lack of confidence in AstraZeneca?
Could you say that again?
Are you concerned that eligible people, so over 50, are holding off from getting the vaccine due to a lack of confidence in AstraZeneca?
Well, actually, I think the data, both in Victoria and other states, shows that in every level above 50, we're seeing increased uptakes in AstraZeneca, particularly through our GPs. So I think what the past few weeks have demonstrated right around the country, and certainly here in Victoria, is that there is increasing confidence in AstraZeneca as a safe, viable and effective vaccine to help people over 50 do their part to get out of this. And I would, from the data that I've seen, provided by the Commonwealth, argue that AstraZeneca is increasingly in favour with the over 50s. Everyone good? Thanks everyone. See you soon.